I'm joined now from Sydney by Mary-Louise McLaws. She's an advisor to the World Health Organization. Really appreciate your time this morning. Now, that figure of 1 million was sadly a number we always knew we were going to reach. Did you think it would happen as quickly as it has?
No, I didn't. I mean, this has happened after just 9 months. And of course, this number is severely underestimated. We do have America that's probably overwhelmed. They represent 20% of all global deaths, but they have about 670 deaths per million. And that's fairly similar to the UK as well. So the UK aren't faring very well when you look at it per million. And potentially, if you even looked at it by age group, you might have a lot more explained. But one of the reasons that the underestimation may have occurred is several-fold. One is in the developed countries, they're overwhelmed. So America may be overwhelmed and not keeping up with the death certificates. And they also may not include the word COVID on the death certificate. The other issue in the developed country, particularly the UK, is that it depends where you die. So in England and Wales, if you die in a residential aged care facility or at home, you're less likely to have COVID on your death certificate, which is a great concern. So that in the last 5 weeks only, the number of deaths has increased compared to what it normally is. So they have 40% of all deaths over and above what would be expected for COVID. So the death rate mentioned on the death certificate for people who die at home represent only about 5%. So that leaves over 3,500 deaths at home that are potentially caused by COVID, but we don't know yet. So, and of course, then there are the developing countries that have potentially an unsophisticated surveillance system or testing system. So they're just not being able to give a correct diagnosis, let alone potentially a correct death cause of death. So we will sadly probably see doubling that easily.
Now, as you've just said, we aren't seeing this virus slowing down. The death toll is going to rise. The number of cases is going to rise. And with winter coming soon in the Northern Hemisphere, what would your advice be to governments looking to keep people safe, but also keep the wheels of their economies turning?
Yes. One is to aggressively push influenza vaccination. In some countries, they have done that, and they've found that the death rate has dropped dramatically. So vaccinate your elderly, vaccinate everybody. And the other issue is, of course, is trying to keep people to wear a mask when they go out. I mean, the seroprevalence level, the level of infection in the community in the UK and in Europe is very high, and they're going into second waves. And France's second wave is so high that they are experiencing 56% of all cases from the first wave they've already had so far in their second wave, and it doesn't look as if it's slowing down anytime soon. So they really need to tell people that mask use needs to be mandatory. And of course, they may have to put in very strict curfews, which work very well. They're not very popular, but it stops people who are, as you've talked about with long COVID, between 20 and 39, who will represent most cases in the second wave from acquiring COVID. But sadly, some of them will die, but we don't know how long they'll suffer long COVID for as well. And that will protect them, those curfews and, of course, mask use.
Mary-Louise McLaws live to us there from Sydney. Always appreciate your analysis. Thanks for your time.